Blood transfusion is given by using packed red blood cells created by removing a large portion of the plasma from whole blood, and other available blood components can be administered, such as platelets, fresh frozen plasma, albumin, and several specific clotting factors. Each product has specific detailed requirements for blood type compatibility and infusion techniques. Okay, so we're going to talk about blood transfusion management. The Joint Commission's 2010 National Patient Safety Goals require agencies to ensure that blood components are properly ordered, handled, and dispensed and administered, and the patients are appropriately monitored during blood transfusion. The purpose is to safely administer blood or blood products for transfusion therapy. An assessment includes to make sure the consent is signed, to obtain baseline vital signs, and this includes the temperature, to check the doctor's order for type, amount, and rate of administration, to make sure you have the appropriate size of IV catheter, to assess the history of any blood transfusions and/or reactions, to check for religious or personal considerations, and to assess the compatibility of client to blood product. Okay, we're going to discuss a few special considerations. 2 RNs are to perform blood to client identification checks. Clients with history of previous transfusions must be watched for reactions. Maximum transfusion time for packed cells or whole blood cells is 4 hours, and transfusion must be started within 15 minutes after getting blood from the blood bank. The geriatric population, they are fluid-sensitive clients and they may not tolerate rapid change in blood volume, so you have to administer as slowly as possible. In the pediatric population, you want to watch for transfusion reactions very often because these patients cannot communicate their discomfort. In the home health setting, you want to remain with the client during the entire transfusion and stay for 1 hour afterward. Double check information at 2 different times or have family members verify the transfusion data. Okay, we're going to discuss delegation. Unlicensed assistant personnel may go to the blood bank and pick up the blood. Unlicensed assistant personnel may take frequent vital signs. They are not able to take part in matching of client with blood or hanging of transfusions. RN's responsibility to monitor for complications. Okay, the next thing we'll discuss is pre-transfusion responsibilities. These responsibilities are to prevent adverse transfusion reactions. You want to verify the physician's orders. The blood bank will test donors and recipients' blood for compatibility. You will examine the blood bag for identification. You will check the expiration date. You will verify the patient's identity. You are going to examine the blood for abnormal color, red blood cell clumping, gas bubbles, or extraneous material. You need to use a 20 gauge IV or larger, 23 gauge for kids. I do know that an 18 gauge is preferable. Okay, so let's discuss how to hang blood. You want to verify the consent is signed and verify the physician's orders. Nurse number 1 holds the blood. Nurse number 2 holds the paper tags. Nurse number 1 asks patient to confirm their identity, then reads the donor number, the unit number, the blood band ID number, and expiration date from the bag of blood. Nurse number 2 verifies that the stated information matches that on the paper tags. Nurse number 2 reads the patient info from the paper tags, and nurse number 1 confirms that from the patient ID bands. Nurse number 1 documents all this in the electronic health record, and nurse number 2 verifies the information. Baseline vitals are checked and transfusion begins. Vitals are checked every 15 minutes times 2, then hourly for the duration of the transfusion. Upon completion, flush the line with normal saline and discontinue the blood products from the line. After the blood products have been transfused, you will completely change your IV tubing. Okay, so let's discuss transfusion responsibilities. You want to provide the patient education, assess vital signs. Begin transfusion slowly and stay with the patient for the first 15 to 30 minutes. Ask patient to report unusual sensations such as chills, shortness of breath, hives, or itching. Administer blood product per protocol. Assess for hyperkalemia. Document if the transfusion was ever stopped, and take vital signs again at the end of the transfusion. So let's discuss a little bit about reactions. They could have a febrile transfusion reaction, a hemolytic transfusion reaction, allergic transfusion reaction, bacterial transfusion reaction, circulatory overload. So if they experience any of these reactions, what do? Well, you want to stop the infusion immediately, hang new tubing with normal saline, and keep at a vein open rate. Call a physician and notify the transfusion services. Okay, has anyone ever heard of autologous blood transfusion? This is the collection and infusion of the patient's own blood. It eliminates compatibility problems and reduces risk for transmission of blood-borne diseases. Blood may be collected up to 40 days before surgery, right before surgery, during surgery, or after surgery. So during blood administration, you want to use the blood or blood product within 4 hours after removal from the blood bank. If more than 6 to 8 units of packed red blood cells are given, then give fresh frozen plasma with every other unit. Give platelets, 1 for every unit of packed red blood cells after 8 units have been administered. Equipment needed includes a blood component for transfusion, blood administration set with a filter, normal saline, at least 1,000 milliliter bag, alcohol prep pads, clean gloves, and then you want to record the blood transfusion form and vital sign equipment. Okay, let's talk about the infusion. Prime the administration set with 0.9% sodium chloride and the blood product. Adjust the rate of flow for first few minutes. For adults, platelets or plasma is about 2 to 5 cc's per minute for 5 minutes. Whole blood, red blood cells, or granulocytes, 2 cc's per minute for 15 minutes. Patient should be observed closely for the first 15 minutes. A volumetric infusion pump may be used to administer blood products. Symptoms of an immediate adverse reaction are usually manifested during infusion of the initial 50 cc's. If an incompatible transfusion is terminated early, acute renal necrosis and death may be prevented. Infusion depends upon the patient's blood volume, their cardiac status, and the hemodynamic condition. Suggested rates for adults are packed red blood cells, usually about 100 to 230 cc's per hour, granulocytes 75 to 100 cc's per hour, plasma platelets 200 to 300 cc's per hour, and the entire platelet production should be given within 1 hour if possible. So during the infusion, we are going to monitor for reactions. This includes to continue to monitor the patient for signs and symptoms of adverse reaction during transfusion and 1 hour post-transfusion. If patient experiences a transfusion reaction while transfusion is in progress, immediately stop the transfusion. Maintain patency of the line with normal saline and notify the physician immediately. Upon completion of infusion, you will note in the client's chart date and time of initiation and completion of each unit transfused, type of blood infused, the first set and subsequent vital signs, presence or absence of transfusion reactions and the actions taken, the client's state after transfusion, and current IV fluids infusing, if there are any. Okay, so now we're going to discuss adverse reactions. Remember, we said there was allergic, potential for infections, and hemolytic reactions. Allergic reactions can present as an urticarial rash or mild pyrexia. This can also develop into edema around the eyes or larynx and cause dyspnea. Full anaphylaxis is uncommon. The appropriate action is to stop the transfusion and to notify the physician. And then subsequent transfusions might actually require pre-medication with the prescription for an antihistamine. Okay, discussing infections. Although donated blood is screened for major viruses and bacteria, infections, although they're very rare, do occasionally occur. Platelets are stored at room temperature and so can act as an ideal medium for bacterial growth. You want to check the cannula insertion sites regularly for inflammation and infection, and you want to change the insertion site routinely every 72 hours. And when you use platelets, bags should be checked for discoloration, which may indicate the presence of bacteria. A hemolytic reaction is caused by destruction of the donor red blood cells by antibodies in the recipient's plasma. It can occur after only a few milliliters of blood are transfused, although a delayed reaction can occur up to 2 hours later. Hemolytic reactions can be fatal. A suspected hemolytic reaction must always be responded to as a medical emergency. Continuing with our adverse reactions, we have circulatory overload. It is less of a problem now that concentrated red cells are used more frequently than whole blood. Problems can occur with geriatrics and neonates. You may need to give diuretic therapy and slow the rate of transfusion and observe closely for pulmonary and peripheral edema. And then we have iron overload. With multiple transfusion, there is an increased serum ferritin. At a level greater than 1,000 milligrams per liter, the iron infiltrates organs such as the liver, heart, and kidneys, which can lead to organ failure or even be fatal. There are 2 videos demonstrating blood transfusion in this lesson area. Please watch these videos. This concludes the lesson on blood transfusion. If you have any questions related to this content, contact the instructor.